This program and its contents are designed for information and educational purposes only. This program does not render medical advice or professional services and is not intended to be a substitute for professional care. The information provided here should not be used for the purposes of diagnosing or treating a medical or psychiatric condition. If you have or suspect you may have a health problem, consult your healthcare provider.
Positive Momentum TV is brought to you by Movement Solutions.
In my opinion, a lot of the problems that go on in the world today are the result of trauma, that we're all kind of trauma survivors in one way or another. And if we don't know how to regulate our emotions about that, it's those problems that contribute to our abilities to get along with each other, resolve conflicts, and be effective in creating and growing and being positive. And so taking people who've been traumatized, who oftentimes have black and white thinking and who have a lot of judgments about themselves and others, and teaching them these skills, which are kind of a blend of Zen and Western therapy. And there are people who argue, well, we could just teach them Zen. Why don't you just tell them to go to meditation classes or something? But it's not. That's not enough. It's really the combination of these skills that I think contribute to the effectiveness of DBT, which, by the way, has been, spotlighted as one of the 100 most important discoveries of the last decade. So I think that DBT has the potential to help us deal with more than just the individual problems that happen. They're using DBT in prisons right now to help decrease fighting and self-harm that happens in prisons, because of course a prison is a very invalidating environment.
Oh, sure it is.
So it's kind of interesting. Wherever you find invalidation, you will find these behaviors, these issues of emotion regulation, interpersonal problems, distress tolerance problems, impulse control problems. Even looking at, now we know that trauma changes the brain. You can see that on MRIs, and that it's generational. I think about the American Indians and what happened to them and what happened within their culture. And then I look at what happens within the gay culture and how that's such an invalidating environment. And what happens in the African American culture. All of these different cultures have this hugely invalidating environment. And oftentimes we look at behaviors associated, stereotypical behavior that doesn't really go with these groups, but has been identified sometimes as part of these groups. It's kind of like what used to happen to sexual abuse survivors or rape survivors. They would be affected by the trauma, act out in some ways, and then be blamed that there's something wrong with them. Right. And the whole point, I think, in DBT is that this is the natural response to invalidation. And that if we do something about it, that ends. Then we can actually get together and maybe end the environmental piece that contributes to the problems associated with emotions and all of that. So recognizing that in these pockets of invalidation there can be these behaviors, and that doesn't have anything to do with the people involved or the culture of the people involved. It has to do with the culture of invalidation and what that does. And it's, if you think about, oftentimes we say people who have been sexually abused end up sexually abusing other people. People who have been beaten as children are more likely to be violent parents. They're not always, but it is a contributing factor. If you can't validate what you've been through, it means you kind of have a blind spot, and there's this propensity to repeat it. Or to have such an opposite reaction to it that also creates some pathology in terms of avoidance or what have you. So parents who are beaten may not discipline their children at all, or over-discipline their children. but there are these sort of extreme reactions. And if we were to validate trauma and validate what happens to children, there wouldn't be these blind spots where we can repeat the behavior generationally over and over and over again. And I think it's the invalidation that causes us to keep doing things, even when we say to ourselves, like you said earlier, the idea of, I don't want to be like my parents, and then you find your parents' words coming out of your mouth. Mm-hmm. We do what we know.
Yeah, and it's taken me decades to finally forgive my parents and say, you know, wait a minute, that's all they knew. Only because I had to get to the point where, wait a minute, that's all I knew. Mm-hmm. And then I could finally go back to them and say, well, I forgive you. Mm-hmm. But by that time, the damage has been done to another generation.
Positive Momentum TV is brought to you by Movement Solutions.